I was personally impacted by the fires. There was a major disaster, obviously, in Los Angeles. 2 huge cities were burned down. Right after it happened, myself and the administration at St. John's, we sat and we said, how can we do something about this? How can we help? We thought the best way of helping the community is to start some kind of program, some kind of clinic where we can see patients that are going to suffer from the fallout of these fires. I've had experience before in New York. I was actually in training during the 9/11 attacks. So I've lived through it once. I've had experience helping out the victims of that disaster, that we thought it would be a great idea to start a pulmonary clinic to help with any issues that may arise immediately from the fires, but also long-term issues from exposure to the toxins. The patients can call in. We have a clinic right now 1 day a week. We can expand that as needed, but for now, 1 day a week is working well. They call in, they come in, we make an appointment for them. I see them, I do all the necessary testing that day, whether it's pulmonary function testing or imaging. We try and take care of the problem right then and there. So the clinic is 3 phases. The first phase was the immediate during the fire and immediately post-fire, the first few weeks after the fire, issues that these patients are going to have. Mostly it's asthma exacerbations, emphysema exacerbations, allergic reactions to some of the toxins. The second phase is during the cleanup phase. And during that phase there's going to be a lot of exposure to the toxins. A lot of the ash is going to be kicked up into the air. Some people have actually moved back, and then people that live in the immediate community, and then also the workers, whether it's the government workers, the military, LADWP, LAPD, or LAFD. All of them are going to be exposed to this. The third phase is the long-term phase, which is, I think, 2, 3, 4 years down the line and even longer. The first phase, we saw a ton of patients. Some of them that were actively sick, I'm having come back. Some of them that were just concerned and didn't know, they're coming back on an as-needed basis. During the second phase, which is now, I have a feeling that these patients, I'm going to start having them come back regularly, and I will follow them up regularly. And then the long term will be a definite every 4-month follow-up, depending on how sick they are. In addition to the clinics, we're doing 2 other initiatives, actually 3. The second initiative is we're having community outreach programs. We're going to go out to the community. We're going to educate. We're going to answer questions. And we're going to test patients in the community, test their pulmonary function, test their vitals, make sure that their lungs are doing okay. The third initiative is webinars and lectures. We've already started those. We're going to be distributing it out to the public, and it's going to be available to the public, of whether it's myself or other experts talking on different aspects of the fire and the toxins. We're doing quite a bit of research on all of this, so that the research, I think, is going to help patients immediately, but also help future patients if these issues arise again. And really not if, but when these issues arise again. So education is a big part of it, and I think it's easy to tell people to move, but that's not reality, and it's impossible to have someone whose livelihood is here to leave Pacific Palisades. So that's not realistic. What we can do is educate them on the proper PPE protection, N95 masks, goggles, etc. when they are in the area. And at least during the cleanup phase, they're going to need a lot more of that. St. John's, I think, is the ideal location to do this. Number one is it's very close to Pacific Palisades. A lot of the community of Pacific Palisades, they are patients of St. John's. So I thought it would be the perfect place. Second, we have started a huge pulmonary division at St. John's. There's myself, my partner, Dr. Chaux. There's a physician's assistant, Carolyn Prina. We are board certified in pulmonary and critical care, and I'm board certified in sleep medicine. We're also board certified in internal medicine. We are also interventional bronchoscopists, so we do a lot of interventional procedures. As needed, we have a cardiothoracic surgeon. We're seeing patients for lung cancer, pulmonary hypertension, pulmonary fibrosis, emphysema, asthma, We're doing many procedures, minimally invasive procedures. We're also seeing patients for sleep medicine. We're starting a sleep medicine portion of all of this. So all of that combined, now throwing into the mix this Disaster Relief Clinic, I think it's going to be a very strong pulmonary division here. So I feel that number one is immediately, it's the perfect location, the perfect place for these patients to come. They've loved the clinic. They love that we're doing it. They love that we're educating them, and they love that it's so close and they can come see an expert in the field. But long term, with more research that we're doing, more procedures that we're doing, it's going to be the ideal place to take care of any pulmonary patient.